So shoulder pain can come from a lot of different sources. You've got bones, muscles, tendons, ligaments, rotator cuff, cartilage, lions, tigers, and bears. Oh my, just kidding. But there's a lot going on in your shoulder. So there's a lot of sources that can cause pain. There can also be some referred pain. So if you've got shoulder pain, get an adequate diagnosis, make sure you know what's going on, and then look at your options. Well, the shoulder is a very important joint within our body. It has the biggest range of motion of any joint within our body. And because of that, it has a lot of structures that need to be taken care of. And it's attached to some of our most useful appendages, if you will, hands, arms, and so forth. And without that, we lose a lot of the function that we enjoy and have learned to use throughout our lives. And so if you're having shoulder pain, it can be a very significant problem. Well, shoulders obviously are very complex structures. It's the joint that has the most motion inside of our bodies. And so sometimes sorting out where the pain's coming from and what the problem is can be very difficult. So make sure you get an adequate diagnosis. Sometimes it requires imaging, sometimes it does not. But making sure you get a good diagnosis is absolutely critical. And that sometimes means getting a second or third opinion. That doesn't bother us at Denali. We really want our patients to be well informed, well diagnosed, and sorted out so that we can offer them the best care. Well, anytime you start to treat or have issues with your shoulder, if you've got an injury, you've got a problem, really making sure you get treatments that minimize the side effects and minimize the complications is critical. The challenge that we have is that many surgeries leave you with scar tissue, and they may or may not fix the problem. You really want to look at all of your options when you start to have shoulder pain. So first, make sure you get an adequate diagnosis. Second, look at several options. There's a lot of complications with surgery. There's complications with cortisone. And so make sure that you really need those procedures before you do that. Stem cell is certainly getting a lot of attention lately, and it's going to be amazing, but it's just not there yet. It's very expensive and really has a 50% chance of success, which is actually pretty low. So look at your options, make sure you get a good diagnosis, and make sure you understand the side effects. Certainly people will say certain things have minimal side effects, but make sure you dig deep and find out what's really going on. Well, at Denali, we obviously take a good hard look at a lot of the different options for taking care of shoulder pain. We're obsessed with getting patients better. That's just the reality. And so we've looked at everything from stem cell, Renew-O2, Prolozone, PRP, PRPO2. We've looked at hyaluronic acid injections, and the list goes on and on. After 16 years in emergency medicine, I saw the complications and the benefits of surgery. There's a time for surgery, but there's also a time not to have surgery. And so we've looked at all of those different options. And if you'd like to know more about those options, complications, costs, those type of things, go to denalimed.com, where we've got some additional information. We've actually got a chart that you can look at that really looks at each of those options. Shoulder pain comes in a lot of different forms. It can be acute, meaning it happens right away. That's usually associated with some type of trauma. And if that's the case, often the best place to get care is an urgent care or an emergency department. There they can perform some really quick imaging and see if there's something that really is a surgical emergency or needs to be taken care of right away. Many of us, though, have shoulder pain that kind of accumulates over time, a gradual or insidious pain. And in that scenario, most patients will start with their doctor or see an orthopedist or those type of things. But we at Denali also are experts at diagnosing and figuring out what's going on. So make sure you look at several options. Make sure you get a good picture of what options you have by going to several different sources. Second and third opinions are actually very empowering. Don't be afraid of that. We certainly aren't. And we look forward to maybe seeing you for a quick consult at Denali Med. The amazing thing about shoulders and our human bodies is the reality is if we do something that causes us pain or is starting to cause damage, our bodies warn us through pain, through lack of function, or what have you. And so the reality is it can be really simple as far as, if it hurts, don't do it. And I know that sounds overly simplistic, but I'm amazed at how many patients come in and say, yeah, every time I do this, it causes significant pain. And so, and sometimes the adage out there is push through the pain. Well, that can really lead to some significant problems if you don't listen to your body. One of the other really important and new findings is that actually if we have an injury, we need to limit our ibuprofen use. Now, ibuprofen has really been pushed as one of this amazing anti-inflammatory and pain medicine. And it can be, but it really has a very short window where it should be used, very short. After that, what they found is it actually blocks your body's ability to put down new collagen. And so that can be a problem. So if you find that ibuprofen or other NSAIDs, naproxen, Aleve, those type of things is something that you need to get every day just to function, you've got a significant problem and you need further evaluation and care. So again, don't be afraid of getting several options, but if you'd like us to take a look, denalimed.com, you can get our phone number, give us a call, and you can get some more information about shoulders and shoulder pain there.